Good afternoon, everyone. And my name is Brian Goodman. I'm the Managing Director of the Major Corporate side at WPA. And welcome to the Health Implications of Long COVID. This is the latest in a series of webinars by WPA Health Insurance on highly topical and relevant subjects. We're extremely lucky today to have HCA's Director of Rehabilitation Services, Claire Dunsterville, who I hope will shine a little more light on long COVID, what it is, and what can be done to treat it. This is unfortunately something new which we're all going to have to contend with in some form, as it has implications for individuals who have had COVID, employers, medical insurers, and healthcare professionals. Claire is going to speak for around 15 minutes, following which we will have a question and answer session. Please ask any questions that are on your mind by clicking the questions tab in this window. If the window is not there, click the white arrow on a red background and it hopefully should appear. If we get lots of questions, I will try and group them all together. So in order to make the best use of your time today, I'm going to hand over to Claire. Claire.
Thank you very much for that lovely introduction, and to WPA for inviting me to speak about this to you all today on a particularly somber time in our journey with post-COVID so far, in that we've reached that 100,000 deaths in total, but also now looking forward to what does this mean for us, and what are the long-term effects that we've got to start considering. And so my aim really today is just to give you a bit of oversight into some of the terminology and conditions that we're now talking about, that COVID is throwing up into the mix in terms of its long-lasting effects. So I'm going to talk you through a little bit around the terminology, some of the symptoms that we're seeing, and who it might affect, and then very welcome for questions and answers at the end. So obviously we've been living with COVID now for the last year, and we've learned an awful lot about it in that time. We know that it's a multi-system condition, so it can affect any organ in the body. There's an element to COVID that causes clotting, thickening of your blood. So wherever those clots may appear could potentially cause a problem. We have been grappling with trying to define it and understand exactly what this condition is and the various stages that we're now seeing and hearing about in the media. And so to give us further guidance on that, the National Institute of Clinical Excellence has come up with the following definitions. So the first is acute COVID. So this is in those first 1 to 4 weeks post-infection and diagnosis. And this is the sort of COVID that you're hearing about with regards to hospital admissions. So these people may be acutely unwell, they may require hospital admission, and in the most significant cases are going to require support on intensive care. But also within that acute COVID category are people who are managing those symptoms at home and not requiring that support and able to manage it with the usual sort of cough, cold management. Acute COVID and those patients who have been really unwell with it in intensive care is going to cause us some problems longer term. Anyone who has been through a period of time on intensive care is going to need some rehabilitation afterwards. But COVID is keeping people on intensive care for days and weeks at a time. So I can tell you quickly about a patient that we had who came through our rehabilitation service early on. He'd been in intensive care for 40 days and in hospital for 72 days. So you can't come through that without an element of debilitation, muscle wasting, post-traumatic stress disorder, which is very common after you've been on intensive care for a long period of time. And a need to rebuild and get your nutrition, your muscle and energy levels back. So there are long-term implications there, which again can be easily supported with rehabilitation. And the gentleman I referred to actually was able to return home, care for himself, no need for oxygen. We've got his stress and his anxiety under control within a 4-week inpatient period. So that was very successful, and that's not alone, that's quite a common picture. The second category is ongoing symptomatic COVID-19. So this is a group of patients who are now in that 4 to 12 week period post-infection. And these are the people who will have rumbling symptoms, breathlessness, cough, intermittent fever, interestingly enough, and just really not feeling great. But in the main, you're seeing a picture of general improvement. So week to week, they're starting to feel better. It's just taking a long time to recover from. And actually, again, when you know that it affects every system in the body, potentially, then you can understand why that is the case. The final category, and the one that I really want to talk to you about today, is post-COVID syndrome, which is in that 12-week plus timeline. So these are patients who would have initially received a diagnosis, either because they were symptomatic or perhaps have been asymptomatic and picked up through a surveillance system, either because they've got relatives who've been testing positive or through a workplace surveillance system. They may not present at the time of infection, but actually they continue to struggle with symptoms beyond that 12-week mark. So again, to give you an example, we've had a colleague in our hospital, one of our physios that I work with, who ran into work on the day that he tested positive on a staff surveillance program. Absolutely fine. This guy runs marathons on a fairly regular basis at a very fast pace. And actually his symptoms didn't occur till about 2 or 3 weeks later, when he was struggling with breathlessness. He was really having difficulty running. And actually when we tested him, he had multiple pulmonary emboli, so clots on his lungs, as well as inflammation around his heart. So you may test positive, but you may not be symptomatic until a few weeks later. So this is a really interesting group of people. It does also capture those group of people who perhaps have had ongoing symptomatic problems in that earlier category, but aren't seeing that improvement and are continuing to struggle and not getting any better. So I hope that's outlined for you those 3 different categories within COVID. So talking about that last category, post-COVID, which is also known as long COVID, or you may hear patients referred to as COVID long haulers. Who might it affect? Well, the evidence is still very scant. We're collecting lots of data about COVID, but remember, a lot of these patients won't be travelling into work. They may be working from home, and actually their full ability to return to work or return to previous lifestyle whilst you're in lockdown is not being fully tested. But we are making suggestions that up to even 1 in 20 of those people infected with COVID may struggle with long COVID. So clearly that's got significant implications for the longer term. And don't forget that at a rate now of, I think it's 10,000 new infections a day, there's going to be a long tail on this. So whilst we've got vaccinations rolling out, we are still seeing people now just being infected, and will do until everyone's vaccinated, who may then still be suffering from long COVID a few months down the line. I've already said it's a multi-system condition. What that means is that no 2 patients are the same. No presentation is the same. We're seeing, I'll talk through the symptoms shortly, but we're seeing a wide range of presentations and symptoms from people. All ages can be affected. Now, as with acute COVID, it is the older generation that will present with worse symptoms. But actually, when we're talking about responsibility of employers, it's actually those professionals, the people who are trying to get back to work, for whom this is going to have greatest impact on. So whilst those who are older and have pre-existing conditions may be more prone to this and may get symptoms that are worse, it's going to be the younger population for whom it's going to impact on in a functional sense. And we've already said no to cases of the same. So let's talk a bit about the symptoms. Now, the large majority of patients who are coming through our service are presenting with respiratory symptoms. So that might be breathlessness, a persistent cough, but also we're seeing people with chest pain on activity and on general movement. And I'll leave you to read through some of those symptoms, but you can see just how broad they can be. Interestingly, one of the other categories that we're seeing quite a lot of is brain fog. And that can consist of people who are struggling to remember things that they've done the day before. So again, referring back to working age professionals, people who might have sent a lengthy email the day before can't remember the content of it, or can't concentrate for long periods and feel very exhausted after spending time at a computer. We're also seeing poor sleep and gastrointestinal symptoms as well, so flares up of Crohn's disease and other issues. Key to supporting recovery in this group of patients is early intervention. So we're talking about a condition where we're not diagnosing it really until they've had symptoms for or have been infected for a period of 12 weeks plus. So already you're a little way down the line. And when you think about anxiety and managing some of those issues around return to work, actually you've probably already got a fairly anxious picture there of someone who still doesn't feel right, still doesn't feel normal, can't see a way forward. So early intervention as soon as you can once you've made that diagnosis is really important to be able to give a vision and manage some of those issues, concerns, worries, anxieties. Also important is making sure you know what you're dealing with, so accurate diagnosis. And whilst there's no real test that says, okay, you've definitely had COVID, although you can test antibodies, what you can do is rule everything else out. And I think for everyone, there's a worry that underlying this great range of symptoms that I've talked to you about is something that's more sinister. And when you look at that group of symptoms, it could mask all sorts of things. So by diagnosis, it's as important that you're ruling out something that could be missed, but also knowing what you're dealing with. So going back to my physio who had lung clots on the lung and inflammation around the heart, when you know what it is you're dealing with, actually there may be some medication that can support that, but certainly some sort of treatment program that you would start before you start some sort of rehabilitation service. Multidisciplinary input, absolutely vital. So again, you want to have specialists looking at people to really know what they're talking about. And the great thing is, the positive about this is that where COVID is so rife across hospitals and health centres in the UK, actually we've got many specialists who have built up a real expertise in managing COVID and understanding what it is. And they're all talking to each other. So it is important that if you've got someone with gastrointestinal symptoms, as well as anxiety, as well as respiratory conditions, that you've got the right people looking at that, and that they equally can draw on other professionals to support recovery. So they support the diagnosis, and then you lean on your physiotherapists, psychologists, occupational therapists to build a holistic program to get someone back to work. So you've got your diagnosis, you've built your team around your patient. It's now about being very clear about what the next steps are. So talking to that point around what are someone's goals? Now, my goals might be very different to my colleague who runs marathons. I don't have any plans for marathons or triathlons, certainly in the near future. But for him, getting back to that was really important. He has a young daughter who participates in a lot of outdoor events, so he wanted to make sure that he was doing that. But also he was really keen to return to work. Work is his life. He defines who he is by the fact that he's a physiotherapist. He works on our cardiology floor, and for him, that patient interaction is critical. So any program, any recovery program needs to take account of that individual, their goals, their aspirations, other factors about what it is that they need to return to work-wise, what occupation is it that they do, what are the hobbies and interests that they got, have to form part of a paced return. So when I talk about paced, this is having conversations with your employer, with your rehabilitation team to work out what the end point is. Full-time work in the city or part-time work, but working from home. And then you're making those staged points. You're staging your return to different activity, allowing for rest, allowing for recuperation, and allowing for dipping your toe back into the water. Now, if you do this and you have your paced return to work and activity, you are far more likely to be successful than if you keep trying to push yourself to do more and more and more. That's going to actually be detrimental to any sort of progress and recovery. So it does need to be done under a degree of guidance. And key to all of this is listening. And I was chatting to one of our consultants the other day. He said, you know, everyone in healthcare at the moment is pushed to their limit. Not everyone has the time and the ability to listen. And this is why the government has set up post-COVID clinics, and why we ourselves have set one up as well. You need to be in a service where someone can listen to those concerns, to those anxieties, to those aspirations, and piece everything together. Because you've got individuals here who will have been fighting with something that has landed on them unexpectedly, previously fit and well in many cases, and they need to find a way forward. So they have to be listened to. So what to expect generally from any sort of post-COVID service? Here, for us, it's about rapid access. And the same, I think, would be said for the NHS post-COVID services as well. But getting people to the right specialist, and then agreeing that treatment plan, and then arranging for the rehabilitation. Now, again, across healthcare at the moment, it's just a note for you all, really, that many of these consultations can happen virtually and need to happen virtually because people aren't able to leave their homes, don't want to leave their homes. But also, again, coming back to that point about being listened to and anxiety, in many cases now, healthcare centres are set up to be safe. You're coming into a safe environment. And it is sometimes better for someone to sit across the table from a consultant and talk to them frankly about how they're seeing. So we're really proud to be able to offer that face-to-face service as well. So hopefully that's given you an outline of COVID, some of the terminology around it, and actually given you a feel for what we might be looking at in the future. So very happy to go to any questions that you might have.
Claire, thank you for that insightful presentation. One thing that's clear to me is that this is yet another world of uncertainty and complication that this pandemic has brought about. And it's clearly going to be with us for a while to come. Now, we've had quite a few questions coming through, so let's see if we're going to make a start on that. So, first one I've got here, Claire, is, are there any sectors of the community who are perhaps more susceptible to having long COVID? I think you already mentioned about elderly people being more likely to suffer.
Yeah, I think certainly we've said symptoms can be worse the older you get. Certainly with acute COVID, we've been really concerned about the BAME community. And we are not seeing that's the same in long COVID, but it may be that you have got predisposition there to other existing conditions such as diabetes, which may make your recovery a little harder. I think the challenge with long COVID or post-COVID is actually, again, about what it is that someone wants to get back to doing, what their role is in the community, and what other pieces they do. Do they care for other people? Are they a key worker? Have they got to get back to a particular activity? So seeing less so far in the data around specific community groups being impacted.
Okay, next question. If I identify a colleague that's struggling at work, what sort of questions should we be asking to understand if they might have long COVID? And I suppose that question will also apply to family members at home. If somebody, who should they contact?
I think your starting point has to be a general practitioner. And again, this comes back to, you may not have needed hospitalisation, you may not have been that bad, but you are continuing to struggle with the symptoms. So I think that conversation is, well, does this feel like it's something that's getting better? Or does it feel like something that is getting a bit out of control and you're struggling? To be honest, that word struggle is probably the key word. And at that point, I think you need to seek additional help. So general practitioners are a good place to start. They can certainly link you in with some of the resources around. And actually, there's plenty on the NHS COVID website, lots of information leaflets now, which is great. But I think linking people into a health professional who can dig a bit deeper and make sure that actually, again, they're asking the questions that might rule something a little more sinister out.
Okay. I think you mentioned earlier that people who actively seek out treatment are likely to recover quicker. But the question is, how long do you think people with long COVID will take to recover?
So I can talk to our experience, and again, getting a wide range of people through our doors. It's very difficult to tell because everyone is so different, but we are seeing that with a paced approach, we are getting some people back towards normal within that sort of 3 to 6 months post being diagnosed as long COVID. So this is a long-term thing, and I think it's important that we all get our heads around that. There is no point at all in trying to rush this. But within that 3 to 6 month window, you are going to get the majority of people who actually give them a little bit of advice, a little bit of support, some reassurance, and let them know what they're dealing with, and they'll be off and sorted within a matter of weeks. And that would certainly be our aim, that getting the right intervention supports a week to month recovery than a month to months and months sort of picture of recovery.
Okay. And this next one seems to sort of follow on a similar vein. So is there anything which someone can do on a sort of self-help basis to shorten recovery periods? I seem to remember reading in the papers myself about people taking vitamin supplements such as zinc and vitamin D to try and perhaps lessen the impact of catching the virus. But is that possibly the same for long COVID?
I think there's very little that we can say definitely at the moment. I think with anything, it is listening to your body, knowing when things don't feel right and asking for help. But certainly rest, plenty of fluids, a good balanced diet do all help. They help to keep you in balance. If the other things that we're finding quite helpful and we're advising people to do are, again, taking that time for mindfulness, so well-being, and making sure that, again, you're listening to your body, but certainly activities such as yoga. You're also dealing with a scenario here where people are sat looking at computer screens at home in one position for a very long time, or your normal exercise routine may have been affected by the fact that we're all in lockdown. And so actually things like yoga or making sure that you're conscious of when you're moving, when you're not, whether you feel tight, whether you feel stressed, and addressing those actually can be very helpful in making sure that you're sort of listening to your body and you're keeping on top of what it is that you need to be doing.
Okay. Clearly, you've obviously been seeing some patients coming in to HCA. Are we going to be likely to see a huge number, do you expect, coming in? And will treatment likely to be available on the NHS?
Yes, so treatment is available through the NHS for sure, and you will see various private services popping up as well. Certainly this is something we all know we're going to be dealing with for a period of time. The NHS has put its resources into some fantastic post-COVID recovery centres. So I think we're at 60 or 70 now across the country. There are certainly 4 or 5 within London at the major teaching hospitals. And again, that's about delivering accessible care to patients who need it and giving them access to those specialists that they're going to need. So they're all focused around that multidisciplinary team and ensuring that individuals can get help. And again, many of those services will offer virtual support. The same for us in private healthcare. It's absolutely vital to us that anything that we do is actually for the benefit of patients. So multidisciplinary teams, rapid access and virtual or face-to-face consultations. I think those have to be the starting points, and then hopefully from that point, patients are channeled through to get the support networks that they needed.
Okay. Time is marching on, but one of the questions is, what are the treatment costs associated with long COVID? And also, similarly, are insurers covering these costs?
So I can talk to our programme and the way that we've worked it. So insurers are covering the costs because it's individual elements that they're covering. So they will cover consultations, they will cover diagnostics, and they will also cover rehabilitation in various forms. So most insurance companies will offer a £500 worth of physiotherapy a year. Well, that's probably going to be sufficient to get you back on your feet and on the road to recovery. But certainly there are self-pay options as well. And I think those are very reasonable. So £250 for a consultation. And then your diagnostics, the costing will depend on what it is you need. But at the very least, you start with a very simple blood test. That's okay. £50, £60. So I do think there's an interesting conversation in here around chronicity and whether this is something that becomes a chronic condition and whether it's funded.
Okay. And then finally, Claire, is there any sort of final key advice that you might give to employers about how they can help employees with long COVID?
I would absolutely go back to the piece that I was saying around listening. I think it's understanding what it is that your employees are struggling with, listening to their concerns, their worries, have they been properly checked out, and what do you understand as their limitations being? Now, most employers now will have access to occupational health departments, use them, but do know that there are services out there that your employees can access, and do encourage them to seek that support through their GPs. But listening and hearing those anxieties is key, time and time again.
Okay. Thank you for some excellent questions and indeed answers from you, Claire. However, I'm afraid that we are about to run out of time. I think to summarise, I think we can all agree that unfortunately COVID is going to occupy us for some time. I hope that you found this webinar interesting and informative. We will be circulating the recordings and the write-up next week. Our next webinar for your diaries is going to be on the topic of heart health, and that's going to be on Tuesday the 9th of March at 11 o'clock, and we'll be sending some invitations out in the next couple of weeks, so please look out for it. Finally, as you log out, there will be a 10-second survey, so if you do get a moment to provide a bit of feedback, that really would help us all for future webinars. Thank you all for taking time out of your diaries to attend, and most importantly, thank you, Claire, for a most thought-provoking presentation. Goodbye, everyone. Have a good afternoon.